upcoming blood drive. Last week, the State Health Secretary, Dr. Rachel Levine, encouraged people to donate blood and reiterated the need to donate blood during the time of the coronavirus pandemic. The American Red Cross has a critical need for blood donations due to the severe amount of cancellations, primarily due to the closure of places and facilities where they would normally have the blood drives, such as high schools and colleges. We made contact with the Red Cross, and after speaking to them, they did confirm that the need is there. And while they are at a stable level right now, I have Heidi DeLeo here from the Red Cross who indicated they are at a stable level right now. If we don't have blood donations moving forward or the reduction continues, we could be potentially facing another health crisis, which we want to avoid. Specifically, in Pennsylvania, there have been over 500 canceled blood drives, which has reduced the blood donations by about 16,000. And since March, I believe, what was the total? Since March, we're a total of how many cancellations?
Oh, nationwide? 10,000 nationwide.
10,000 nationwide were canceled. So Pennsylvania alone, 500 canceled, resulted in 16,000 fewer donors. So it's not only an issue here, but it's an issue across the United States. Blood donations, I don't have to tell anybody that it's essential to the health of the community. Every 2 seconds, someone in the United States needs a blood transfusion. So this is of utmost importance. The need for blood is constant. Just because they are stable now does not mean that we can just forget about it and not worry about it. If it continues in the way it's going, like I said, it's going to become a problem, a bigger problem than it is now. So the big issue, or the primary concern, I believe, of people is the safety of blood donations, specifically whether or not it's safe to actually give blood, whether or not it's safe to receive blood transfusions, whether or not it's safe to show up to a facility in light of the social distancing. So here's what I'm going to tell you, is that the blood donation, or the blood drive, is going to be at the Assembly of God Church in Peckville. It's a 10,000 square foot space. It's very large. They've had blood drives there before. It's large enough so that people will be able to maintain a safe distance away from each other. They're going to take new safety measures. They already take thorough safety measures when having a blood drive, but they've added additional safety measures, such as they're going to take the temperature of employees, volunteers, and donors before entering the drive to make sure that they are healthy. They're going to provide hand sanitizer for use before entering the drive, as well as throughout the donation process. Because it's, like I said, 10,000 square feet, they're going to follow all social distancing practices between donors, including donor beds, as well as waiting and refreshment areas. They are also increasing enhanced disinfecting of surfaces and equipment. And we are emphasizing the importance of making appointments. The more that people make appointments, the better off, or the more it'll be easier for them to allocate the space between people, and to make sure that people are not too close together, and to maintain social distancing, and just to have a smoother blood drive. So it's going to be April 16th, that is a Thursday, at the Peckville Assembly of God Church from noon until 5 p.m. So that's about 2 weeks tomorrow, I believe. So again, Peckville Assembly of God, Thursday, April 16th, 12 to 5. I will be there donating my time, volunteering, and my blood. The Red Cross has also implemented standard staff assessments to ensure that the staff that are going to be working the blood drive are healthy. Not only taking their temperature, but telling anybody with any type of symptoms to stay at home and not come to the blood drive at all. It is very important for the public to realize that the coronavirus cannot be transmitted through blood transfusions. So donating blood or receiving blood via a donation is not going to render you susceptible to the coronavirus. Again, we strongly recommend that you make an appointment. If you cannot make an appointment, then show up. We really need people to turn out to this event. Another event was actually scheduled and canceled for that day due to the closure of the building. So we filled that spot. If you want to call ahead to make an appointment with the Red Cross for that day, again, which is April 16th from noon to 5, you can call 1-800-RED-CROSS. Are there any questions before I move on with regard to the blood drive?
Commissioner, this is a county-sponsored blood drive? I just want to make sure I know how to describe the relationship between the county and the Red Cross.
Well, I am involved. I do have a flyer. We're partnering. My
okay.
name is on it.
Okay.
But the Red Cross is doing all the work.
Okay.
They've been a pleasure to work with, and I really hope that this is a successful event, again, because we are already facing an issue, a significant pandemic with coronavirus. We do not want to have on top of it a shortage of blood and face a second health crisis. So I'm not trying to scare anyone. I want everyone to remain calm. I just want everyone to know that this does have to happen. We really need the community to pull together for this cause and to please show up on April 16th to donate blood. Any other questions for either myself or Heidi DeLeo from the Red Cross? Okay, so we just wanted to touch about a few things from the county's perspective. We just wanted to remind people that, first of all, we are still operating under the same measures that we indicated at the press conference on March 20th. But there is valuable information on both the county Facebook page and the county website. The county website and the Facebook page contains information regarding health care, state information, federal information, information pertaining to your family. The website is www.lackawannacounty.org. Now, a very important resource for all residents is the Area Agency on Aging Department, which that department has been wonderful throughout this entire process. If you go to the county's main website, lackawannacounty.org, and you click on the Government Directory tab, which is up in the right-hand corner, you scroll down to Human and Outreach Services, and then you'll see a bunch of boxes, and you click on the Area Agency on Agency box. So if you're an older person, or you know somebody who needs any type of assistance, you can most likely find the information online. Now, also on the county's website, we want to point out a very important link. It's in pink on the main page, and it's titled Women, Children, Families, and Community Resources. And again, it's all in pink, and if you click on that, you will find a plethora of information, including but not limited to information concerning takeaway meal services, food pantries, and daycare, child care centers. You're also going to find information from the Women's Resource Center and also information from the NEIU pertaining to children with special needs. So again, we have a lot of information on there. Our staff has really taken a lot of time to make sure that it's up to date. So it's a valuable resource for all of our residents. The county website also provides up-to-date information concerning the coronavirus, including state mandates and all the orders that have been issued on an updated basis from Governor Wolf. Now, the Lackawanna County Department of Planning and Economic Development, which is run by our director, Brenda Sacco, she wanted me to remind everyone that there's information on her Facebook page, and again, it's Lackawanna County Department of Planning and Economic Development. There's a lot of information on there for small business owners. I know this is a time of high anxiety for small businesses, so please check out her page, and hopefully that will provide you some information. Now, if any of our older residents require assistance of any kind, not just meal service, but any type of assistance, you can call the Area Agency on Aging at 570-963-6740. And Jason Kavulich, who runs that department, will get whatever you need, or whatever type of assistance you need. He'll handle it, and his response time has been amazing. This does not only address the concerns of our older residents. He has informed me that if any residents of Lackawanna County needs any assistance of any kind, including meal service, they can call the department, the Area Agency on Aging, again at 570-963-6740, and someone from that department will either directly assist or will find resources for the person calling. He has informed me that they have delivered meals and provided meals to people who aren't under the category of older residents of Lackawanna County, just residents who are in need of food. So feel free to reach out to him, and again, he will either directly assist or find resources for you. The Area Agency on Aging continues to collaborate with other agencies to provide door-to-door food distribution. We still need volunteers. Things seem to be picking up a bit, so we're getting busier. So if we really need volunteers to fill bags or to deliver bags. If you're interested in becoming a volunteer, you can either call 866-2998, or you can email volunteer@uwlc.net. And again, we just ask that everybody remain calm, continue with social distancing, stay healthy, and we are here at the county for any needs that our residents have. If we can't answer your questions by looking at our Facebook pages or our website, then call us, either the Commissioner's office or, like I said, the Area Agency on Aging, and we will make sure that somebody gets help to you. Does anybody have any questions?
Commissioner, I don't know, this might be a question for you or maybe for Brian, but Senator Casey announced some federal funding today to communities affected by the coronavirus. I think I saw Luzerne County was on the list and Scranton was on the list. I don't know if I saw Lackawanna.
Is not on the list. We have several calls into his office this morning. We haven't heard back from him yet.
So you're not sure why that would be?
My guess is that their numbers are a lot higher than ours down there.
Okay.
It's almost topping 300 today.
Yeah.
That is my only guess. We're at 85 ourselves here. Every number is terrible, obviously, but we do have several calls into his staff members, and we'll have some answers for you later on.
And it sounds like you probably wouldn't know this right away, but why the city of Scranton would receive some of that funding and not the county? Do you know?
I don't know.
Not yet.
But I'll find out.
I did speak to his office prior to the distribution. I spoke to them last week and expressed the need for funds for the county, but Brian and I were just speaking right before the press conference that we are going to be following up right after.
The news just came out about 10 minutes before we came down.
Yeah.
So we'll get some answers today.
Okay.
How difficult of a time is this for the county? How have you guys been dealing with it?
Honestly, our staff has been amazing. Our chief of staff, Brian Jeffers, our emergency director, David Hahn, they've been on top of things. I hate to say that it's smooth because I don't want to jinx things. But they've been working around the clock. We have essential staff working. A lot of our staff, most of our staff are working remotely from home. We're following all social distancing. We're taking temperatures. So even though it's a trying time for everybody in the county, I do believe that we have it under control and we're doing what's best for our residents. But do you have anything to add?
No, that's spot on. Almost all of our essential employees are working from home with computers and laptops. We were pretty proactive in that ahead of time, trying to secure those laptops and notebooks. Our human resources director was spot on, trying to get everything squared away early on as far as protocol and policies are going with the employees. So we were really ahead of the curve and lucky too.
Yes, I did eliminate that. Our human resources director, Justin McGregor, has worked very hard at making sure that our personnel issues have been handled properly. We did have an issue early on getting laptops, but Brian, our chief of staff, was able to find some. It was not an easy task. Our IT department has they've worked around the clock getting everybody set up. So we are in a very good position, even if things move forward in a negative way. I think we're prepared.
We are.
One more question, guys, and again, if you can't answer this, that's fine, but in the event that area hospitals get inundated with an influx of coronavirus patients, have you discussed as a county possible sites for the overflow?
We have. We were contacted, the EMA director, David Hahn, was contacted. I'm sorry. Well, we're trying not to stay with the
Okay.
There you go.
The question was, have we been looking for room for field hospitals in case the hospitals that are with us here today they get inundated and oversized with their beds? We have. The Army Corps of Engineers reached out to us over a week ago to start locating specific sites where they can come in and take over and put beds and equipment in. We have located 3 sites. We've sent those to the Army Corps of Engineers. They go out and they inspect those sites, and then they just contact the owners, actually the brokers that are real estate brokers of those particular properties, and they go in and they inspect it, and if they okay it, then they start setting up when they want to. As of today, the Army Corps has not contacted those property owners as of yet.
Are you guys in a position to say what those potential sites are at this point?
Well, no, and the reason I hold back on that is not because of any type of secrecy or anything like that, but because the Army Corps hasn't reached out to them yet or not, and so that they can actually go in. And if we say it's, you know, bank across the street here, what if they deny it? You guys will think, citizens will see that in the paper, they'll think this is a place, and it's not. So we really like to leave that up to the U.S. Army Corps of Engineers.
Do you foresee the county meeting?
I can't answer that. You know, there's no data that's going to tell us how much this is going to spike or when it's going to spike over the garbage. You know, it's like any other county. It's as long as we're keeping our distance from people, as you can see while we're trying to maneuver around the podium here, we give ourselves a great chance of it not coming as severe as some of the other counties. And that's the only advice that we can give you. Follow everything that the CDC is saying. On our website also there's links that are updated daily from the Commonwealth group of hospitals and the Geisinger group of hospitals. I find it to be very easy for everyone to click on those and check what the daily updates are, because people are trying to file and work with the county every day, so they can go in, try to do their work with the county, and those are one of the first 3 buttons they'll see when they get into the website.
And just to touch back on that funding issue again, since you were standing
No problem. The funding, we found out about the funding probably about 15 minutes ago, where it was going and how it was divided up. We had been in contact, the commissioner has been in contact with Senator Casey's office prior to this, asking for funding. We are not aware of the reason why we didn't receive any funding today, but we will be probably within the hour.
Has the county seen any reduction, either temporarily or more long-term, for any staff or anything like that? A lot of places are taking
Have we reduced our staff at
Yeah.
all? We have not.
In terms of layoffs, so we're enough for
Furloughs?
And also in terms of volunteering, I know some people might be worried leaving their houses to go volunteer for places. You know, is it even safe to do so right now? I don't know. It would be better to
I don't know of any downfall with volunteering efforts. I see there's places all over where they're still giving out free meals and stuff like that. I believe they're going to be doing it down at Scranton High School.
And
I don't see any problem with volunteering.
I volunteered on Monday, and I'll continue to. I volunteered on Monday, and I will continue to volunteer every Monday. That is when volunteers extent is needed, and we wore masks. They did not recommend that we wear gloves, but rather to use hand sanitizer between every delivery. We knocked on the doors, we delivered the packages, and then we moved to the next. So there's no danger as long as you follow the protocols that are established. So I urge everyone to volunteer. This is the time that we need to help each other. And again, the blood drive, Thursday, April 16th. Can't stress it enough. Peckville Assembly of God. The Minister Terry has been nothing but kind to us. He has offered to allow the space to be utilized. It's 10,000 square feet. We